neurology, physiology, and anatomy, clinical reflexes, as well as landmark dermatomes. All right, so for our reflexes and our dermatomes, you might think that this is lower yield, but I promise you this is probably one of the higher yield things that comes from the physiology and anatomy section of neurology. I get millions of questions on these all the time. So let's start off with the reflexes. There's 4 reflexes that you should be aware of. You have your Achilles reflex, which is located essentially at your heel. You have the patellar reflex, which is at the knee, the biceps reflex, and the triceps reflex, both in the arm. What you need to know is the associated reflex nerve roots that are going to cause the associated reflex. So the Achilles reflex, remember it's S1 and S2. The patellar reflex is L3 to L4. The biceps reflex is C5 to C6. And the triceps reflex is C7 to C8. So there's a very clever way in remembering this. It's 1, 2, buckle my shoe, and the shoe meaning that it's near your heel, so it's going to be Achilles. So you know that S1 and S2 are going to be near your Achilles because it's buckle my shoe. 3, 4, kick the door. Whenever you do a patellar reflex, essentially you're testing if your leg kicks, right, at the knee. So kick the door is talking about the patellar reflex, which is 3, 4, L3 and L4. The biceps is going to be 5, 6, pick up sticks. Picking up sticks, right? Whenever you do like a curl, you're using your biceps. So you're curling sticks, you're picking up sticks. That's biceps reflex. And then triceps is 7, 8, lay them straight. And so that's C7 and C8. That's going to do the triceps reflex, and lay them straight, meaning that whenever you lay something down, you're extending your arms and you're using your triceps. Okay. So like, think about the gym. Like whenever you're doing like a triceps workout, you're extending your arms. You're extending your arms at the elbow. So you're laying them straight. Okay. So overall, 1, 2, buckle my shoe. 3, 4, kick the door. 5, 6, pick up sticks. 7, 8, lay them straight. And that is all going to be S1 and S2 is Achilles. L3 and L4 is patellar. C5 and C6 is biceps. C7 and C8 is triceps. That's going to get you a million questions. Okay. Thank me later. So another thing that they might ask is the cremasteric reflex is L1 and L2, and anal wink reflex is S3 and S4. So that's 1, 2, testicles move, 3, 4, winks galore. That's another thing that they can test you on. But I would focus more on the Achilles, patellar, biceps, and triceps. They're very, very high yield. Another thing that they might ask is C5, C6, which is your biceps. If you have injury to that can cause Herb Duchenne's palsy, which is Waiter's tip. And that's just kind of focusing back on more shoulder dystocia secondary to like repro system, right? When someone gives birth and you can cause Herb Duchenne's palsy, which is Waiter's tip, that affects C5 and C6 injury, okay? And that's an upper motor neuron injury. So reflexes are graded based off of like 0 to 4+. If you are 2+, that's normal reflexes. If it's 1+, it's at like lower motor neuron lesion, usually hypoactive. And if it's 3+ or 4+, that's going to be hyperactive and it's going to be more of an upper motor neuron lesion. Okay. Next is the landmark dermatomes. So they love to ask you what dermatome is associated with which specific spinal cord nerve, with spinal nerve. So some of the higher yield ones, C3, C4, C5 keeps the diaphragm alive, okay? So diaphragm and gallbladder, the pain is referred to the right shoulder via the phrenic nerve, okay? So keep that in mind. Phrenic nerve injury causes elevation of hemidiaphragm, and it innervates the diaphragm via C3, C4, C5. Any type of issue with the phrenic nerve is going to have referred pain to the shoulder, okay? So any problems with the diaphragm or gallbladder, it's going to cause phrenic nerve irritation, which causes referred pain to the shoulder. So the right shoulder. So keep that in mind. C6 is the thumbs. So that's another key aspect to remember. And the way that people remember that is do a thumbs up with your hand, and that looks like the number 6. Okay. T4 is at the nipple level. T10 is at the umbilicus, the belly button. All right. That's something that they love to ask about. And then, for anything that's like anal or anything that's involving like the genitals, you have to think about the sacral. So if it's like S2, S3, S4, that's like your anal wink. That's going to deal with like continence and micturition, right? All of the S's, okay? So S2, S3, S4 for the sacral region, that's going to be dealing with like anything in the area of the genitalia as well as the anus. Okay, so keep that in the back of your mind when taking the exam. It's very, very high yield. All the dermatomes, as well as all of the reflexes, are high yield, but they're very easy questions to get. Also, one last thing is for the primitive reflexes. These are relatively lower yield, but what I want you to know is a plantar reflex. The Babinski sign is going to be present in patients, or essentially in all adults that have upper motor neuron lesions. Okay. So if they have a Babinski sign, which is like essentially fanning of the toes after you do plantar stimulation. So you stroke the bottom of the foot. If the toes go upwards and outwards, that's a positive plantar reflex. It's physiologic in babies, okay? But it's pathologic in adults, and it's a sign of upper motor neuron lesions, okay? So keep that in the back of your mind.